How does your solution improve oral health and overall health? And as much as you can quantify the outcomes your solution drives as possible too.
So I am here actually standing for Adam, who's my co-founder and CEO, and unfortunately couldn't make it due to a family emergency. So I'll try and keep it short at 90 seconds. Grin applies digital technology and AI to responsibly transform oral care by reducing hassles for consumer and democratizing access to dental and orthodontic resources, reducing hassles for the provider while increasing their practice revenue and profitability, and most importantly, systematically reducing the total cost of care while improving quality. How do we do that? We actually have three components to our platform. We have a simple yet thoughtful medical device that connects to any phone and can virtually help the doctor reach into the patient's mouth. We also have a web app for the doctor and an app for the patient. So Matthew, when you were holding your teeth and your smile at the beginning of the call and trying to help us all see your teeth, had you used the Grin scope, we would have been very well be able to see every aspect of your oral cavity very well. We get very high scores on the quality of images that we can kind of transport to the other side for the dentist to be able to see. We're proud to help on the early detection, accessibility, personalized care, education and engagement, and some other very important drivers in this space. Grin has over 3,000 clinicians using the platform, touches lives of over 100,000 patients now, and we are very proud to increase access to care and therefore also kind of improve oral health and thereby also improving kind of overall systemic health by allowing to get those images as reported through studies 4 minutes faster, but also allowing from traditional methods, but also allowing the clinician on the other side to be able to review those images 6 minutes faster, which allows to add a lot of time back to those operatories and practices to be able to take care of more patients.
We are really looking to find the solutions that are built to scale and that would have that transformative impact. So when your solution is at scale, it's widely adopted at scale, what's the impact you would see on patients, care teams, education, and or payers? Some of these segments may not be part of your customer group, but we're making this harder now. It's only 60 seconds. And so what is the impact? What is the change you would enable in the ecosystem for any of those segments when your solution is widely adopted?
We would be able to turn the table on value-based care is what we feel. We would turn this whole idea of oral care into being a reactive situation into a proactive situation. We have the advantage of actually being able to meet patients where they are at their homes and, like I said, transport those very quality images that is helped also by AI detection to help the clinician to help the patient be treated earlier. And, you know, it all comes back to the digital, on one part, the digital transformation, but also in the other part, one of our board members has a book that, you know, I love quoting, but the title of the book is Not Just in Sickness, but Also in Health, right? We are able to kind of see the patient and take care of what's needed, educate them, and educate the general public, kind of not just, if we're lucky, a patient is going to see the doctor or the dentist, you know, twice a year. This allows us for much frequent touch points. And, you know, ideally, we could reverse this periodontal epidemic disease that you were talking about, right?
What is the one thing that you need to reach that exponential impact in your organization? Or what is the one ask you have from our audience? You can't answer both questions. It needs to be one sentence or one word.
It's hard because I echo everything that a lot of people said here: integration, distribution, education. But I actually had a little bit more, and this follows Harold's, I think, answer in terms of policymakers. So I think one of the things, and it relates to why this is only the second year that dental health is represented in the health in the digital health hub, and then in health in general. I think there's more conversation to be had on the policymaking side of things. That's why we are collaborating with organizations like CareQuest, why we're pushing on Head Start programs to allow young children to get Medicaid thanks to oral screening and so forth. So there's work to be done there. And I think once policymakers kind of understand and policies, that's the money will start flowing to the right direction, and then there'll be implementation at a higher scale.